back, YouTubers, to my channel. Welcome to basically the newbies and oldies alike. On my channel, I welcome you all and invite you all to my channel right now as I create a mental awareness and just sharing my life story with AS, OCD and the like, as well as just the mental health awareness series that I want to address, as well as everyday health topics that I want to share with you all that may go through your mind as a form of encouragement, motivation, and everything else in between, hopefully. And all further ado, guys, basically, as you're following me right now, I'm doing the epileptic series right now, and basically this is going to be covering of the normal everyday questions that many people may get confused about, and I'm hoping just to hopefully be sure to include every information that is needed right now. Even though sometimes I'll put a disclaimer right now, I am no medical professional. I'm just speaking based on my life experiences of what I've been through, be it depression and the like, and as well as basically with the life experiences that I've been going through, regardless, as well as the training. That some of this is just the information from my training and life experiences. It may not always be 100% true, so always seek second opinion, as well as maybe professional help when you see the clinical warning signs and symptoms of the ones I'm sharing with you, all of these mental health disorders and the like. Also, do seek second opinion if you feel that some of the tips and advice or just anything that doesn't feel fit for you, basically. Or another idea is, if you don't wish for me to watch the rest of what I have to share, that's fine, that's up to you. And all further ado though, as you know, I'm doing the epileptic series, and right now I'm covering basically the management and treatment side of it, which is basically next on my piece. So, and all further ado, basically, this is what's all about. The management of it, all of the treatments. There are very many treatments and managements you can do to help hopefully reduce the side effects of your seizures or what have you, but it's not always guaranteed. Even though many people may think there's a quick fix for all these mental health disorders, but it's not. It's just having the right management and treatment and having the right support of people around them, maybe to just get them through their day, whatever it may be. As we know though, basically for the management side of things with epilepsy, basically the key thing here is basically some of the scans that are available for epileptic patients, such as EEG and your CT scans, will help diagnose epilepsy if need be, if that need arises. But there are also many types of anti-epileptic medications that can help with basically the epileptic patient sufferers. But then again, we know it's just finding the right meds for the right person at the right doses and everything else, like I shared in one of the videos about basically all that, Also, when you develop of it, it's best to go to the nearest government hospital or just a hospital for investigations and treatment. Regular follow-up obviously is required, as well as the medication, until your doctor discontinues the medications when you are fit-free and you have no risk for future fits. Do not stop or reduce drugs on your own, however. As we know, there are commonly different side effects basically that are going to occur if you do tend to do it this way. So treat with caution how you go about your medications, like anything else, like the ones I've shared in the anxiety series of basically the medications and whatnot. For the treatment, however, there's acute and emergency therapy basically, which is the instructions for the layman, which I do wish to discuss. But then long-term therapy are very good methods, however, that is available for treating epilepsy. Certain types of epilepsy can be curable, but not always. Before beginning treatment though, the patient that is suffering from epilepsy will have to be examined to determine whether the cause of the epilepsy can be removed, in which case it may be able to, which is called the casual therapy, which is surgically removing maybe the brain tumour, if it was a brain tumour that caused that disturbance of the brain, basically. To maybe another example there is curing or elevation of the metabolic disorder. In most cases, however, this may not be possible. There are other treatments out there, either because there's no cause for the disease to be found, for the medical professionals to share this, or because it cannot be removed. Because, for example, there is a scar on the brain, which obviously, ironically, and normally in the brain, or the predisposition of the brain's neurotransmitters or what have you. Another treatment, however, for certain types of epilepsies is known as a symptomatic therapy. Basically, this is basically known as 90% of all cases is epilepsy, and it's just a form of anti-epileptic drugs, which I'm sharing there, which obviously the most common ones, those that I may have mentioned in the medications, epileptic medications, are your Tegretol, RX, and some other ones that are really commonly used for epileptic patients. However, as we know, it's been taken over many years though of these ones that I have addressed. Almost about maybe 60% of epileptic patients will become seizure free while taking these drugs, but then again, you know, the condition may further improve within the 20% range. In some cases though, patients can be successfully treated, as I said before, with the epileptic surgery, removal of the brain or what have you, or tumour. However, this is not only possible with focal epilepsies though, and can only be considered as an option, probably 5% for those patients suffering with epilepsy. Basically, also giving a like to the thumbs up that ends this part of the, you know, treatment and therapies. Basically, give me the comments below, so feel free to, you know, comment. Follow me on Twitter and Facebook, SB Answers All. Feel free to also share these videos basically to family and friends to create an awareness and understanding. Also, basically, feel free to subscribe if you haven't done so already, so that you know where I'm at right now with this, basically, as well as many other updates that's leading up to this. So do what you love what you do, love yourself, be kind to one another, love others, you know, be kind to yourself also. Thanks for your support, thanks for watching, I'll see you again soon.